Watch it TVC News. As part of activities marking the 2019 World Hand Hygiene Day, medical practitioners of the Dalhousie Arab Specialist Hospital Dash have organized a campaign to advocate for proper hand sanitizing to curb the spread of infectious diseases. Speaking during the event in Lafia, capital of Nasarawa State, the coordinator of Infection Prevention and Control Unit of the hospital, Esther Audu, explained that this year was dedicated to fulfilling the slogan, "Clean Care for All, it's your hand, it's in your hand." Godwin Agwam was there.
The 5th of May every year is a day set aside as Hand Hygiene Day by the World Health Organization to spread the message of infection prevention and control, including hand hygiene, which is critical to universal health coverage. Anytime we come in contact with equipment, food, and other substances, our hands come in contact with germs, which leads to diseases such as Ebola, Lassa fever, and other contagious diseases. The inability of persons to carry out these all-important tasks, according to the World Health Organization, has led to the deaths of 50,000 men, women, and children yearly.
There are many diseases that can be spread by poor hand hygiene or lack of hand hygiene. And when I say many, there are many, including bacteria, viral, so many. But infectious diseases. So you've heard about Lassa, you have heard about Ebola. During Ebola, people will carry hand sanitizers up and down. But we are supposed to carry on our day-to-day activities.
Some medical practitioners who spoke to TVC News have accepted the hand hygiene culture.
In the hospital, it is always necessary for us to carry our hand sanitizers around, because at any point we can come into contact with infectious agents in the hospital. So as we attend to patients, after each patient, it's expected that every health worker cleanses the hand with hand sanitizer. It's readily available.
Those precautions that are carried out by an individual that will reduce the number of microorganisms that one can contact, that will make you contract any kind of illness, especially what we call food poisoning. Food poisoning does not mean somebody poured chemical in your food. When you carry microorganisms inside food that will make your stomach to be upset, it is called food poisoning.
The World Health Organization stipulates 5 moments of hand hygiene, which includes before contact with patients, after contact with a patient, before performing a clean aseptic procedure, after body fluid exposure risks, and after contact with a patient's surrounding. Godwin Agwam, TVC News, Lafia, Nasarawa State.